Hi, my name is Ever Cedeño. My topic is Pituitary-Tumor Endocrinopathies. Definition: it is an abnormal growth in the pituitary. This is a small gland at the base of the brain. Regulates the balance of many hormones in the body. Most pituitary tumors are adenomas. Symptoms include health and endocrinopathies. Endocrinopathies result when the tumor produces hormones or the destroyed hormone-producing tissues. One video.
So if you've been told you've had a pituitary lesion, the first thing to understand is the normal anatomy in this area. You have to remember the pituitary gland measures about the size of a kidney bean. It sits right at the base of the brain, right above the earlobes, and right in the middle of the head. And it controls all the hormones in our body. And that's why we call this the master gland. And as lesions, whether it be a tumor or a cyst, grow within the pituitary gland, I kind of break it down to three problems they can cause. The tumor itself, because it arose out of the pituitary gland, can actually make one of the hormones and animals. And these are called secreting tumors. They can cause symptoms like hyperprolactinemia, elevated prolactin levels. They can cause Cushing's disease or acromegaly. However, later in life, the majority of these tumors do not make any hormones. So then as the tumor grows, the second thing that happens is the gland gets compressed. Two things can't live in the same space. And so whereas the average tumor size may be the size of a walnut or a golf ball, you can imagine taking a golf ball and squeezing it into a kidney bean. What happens over time is the gland gets compressed. And as you slowly squeeze the gland, the hormones the gland makes slowly shut down. Typically the first hormone that's lost is growth hormone, hence why in kids, short stature is one of the most common symptoms that develop. However, after puberty, we don't grow any taller. And so even though most adults will lose growth hormone, they'll be asymptomatic. The next hormone that shuts down is sex hormone. So in women, it causes premature menopause. That's why oftentimes we catch these tumors when they're smaller. In men, the same thing happens, but they lose their testosterone. And unfortunately, as is most of the case, we kind of write this off and saying I'm getting older, or that's not oftentimes picked up. The third hormone that shuts down is thyroid, which we really need a large tumor and loss of a lot of gland before we lose that hormone. And the last hormone to shut down is cortisol, which is a steroid hormone. Now, thyroid and cortisol are both hormones of metabolism, and so it makes sense that the last two hormones your body is willing to give up. But all these hormones have to be evaluated in all patients before we consider any treatments. And the last thing we worry about is that the tumor outgrows the cavity, which is called the cella turcica, that it sits in. And so it starts pushing in other structures, the most important of which are the optic nerves. Right above the pituitary gland are the nerves that go from the eyes back to the brain, carrying all the visual information. And as these tumors grow, they can slowly stretch those nerves and cause progressive vision loss. Now the body's pretty adaptive. Since these tumors grow slowly, there are some patients who will lose up to 50% of their vision and still not realize it. Eventually, once it starts affecting central vision, people start noticing vision loss, and that's when we oftentimes diagnose these tumors. But by that point, the tumors are already quite large.
Application in medicine. Medical application is a pathology made the cervical resection although this may bring post-surgical tumor growth. Another medical use in this case is radiation therapy, a third procedure in the use for tumor inhibitor drug. Show video.
So I went and had an MRI done, and I had a tumor, possibly cancerous, and there's gonna be a bunch of things that have to happen, but I don't know. I was kind of just scared and shocked. My aunt had recommended this hospital, so we set up an appointment, and then we came up here, and we had a couple more MRIs, met with some doctors.
It's a challenging area to reach historically. Going through the nose to reach it is really a minimally invasive way to approach these types of tumors.
They went through my nose with the camera, and then I think they suctioned it out. I don't really know what happened.
Nowadays, ENT and neurosurgery work together to remove the tumor through our nose.
They did something, some kind of magical stuff.
The majority of my work is the approach, so getting him back to that pituitary gland. Working together in a team approach, it's fantastic. We can collaborate. We have the ability to use both our brains to troubleshoot problems. That's one of the unique things in Nebraska medicine. We've got this great team that can approach things that way.
So what you're hoping for is by removing the tumor that you're going to solve the hormone problem and you're going to prevent the visual problems that would occur if it enlarges. Because one of the realities of the surgery is one of the complications is that the pituitary gland is destroyed. Pituitary gland becomes lost and all the hormones have to be replaced. You have to be willing to accept that. In a young person, that's a potentially really devastating problem. So you have to use some surgical judgment about when you back off. In her particular case, you've got options. You don't have to go for broke. When you get the intuition that you're done, then you're done.
I stayed in the hospital for like a day and a half, I think, maybe 2 days. It wasn't long, but I was in and I was out and it went well.
We have world-class neurosurgeons. We've got extremely highly qualified ENT specialists in this area, and adding the combination of the two really allows fantastic care and extraordinary care.
It's been amazing. I've never had surgery before this, so I didn't know what to expect, but everyone's been very kind and very patient with everything going on. I know when I first had surgery and they were removing this stuff from my nose, I was kind of mean to them, but they handled it pretty well, so definitely a great place to be.
Pros and cons. Pros. In the pathology, the produce to the follower comes to the patient's clinic in the gut. With the advance of surgery resection, seek a repeat elimination the humor mass. Cons. The negative effect of surgical resection in the immediate growth of the tumor mass. Free video.
This animation illustrates the removal of a large tumor near the pituitary gland using the endoscopic endonasal approach, or EEA. The entire procedure is performed through the nose and sinuses without incisions to the face or skull. First, the endoscope is inserted through the nose and sinuses to directly reach the tumor without manipulating the brain or the nerves. The tumor and surrounding area are brightly lit by the endoscope, which has a tiny camera that sends real-time video images to a large screen. Specially designed surgical tools are inserted next to the endoscope to cut through the tumor capsule. In this example, bits of tumor are removed with suction and microscissors until the entire tumor is gone. Throughout the procedure, the surgeons have an excellent view of surrounding tissue, helping them to preserve important nerves and arteries that control vision and other functions. Because the brain is not disturbed, the recovery time after EEA surgery is typically days instead of weeks or months. At UPMC, EEA surgery may be used for a wide array of tumors and lesions in the skull base and upper spine, both benign and malignant. Since there are no incisions to heal, complementary treatments such as radiation therapy or chemotherapy may be started soon after EEA surgery if needed. The EEA surgery is complete, and the patient has no visible scars on the face or head.
Usually applied in Ecuador. Dr. Diego Mosquera, Quito. Esteban Serrano, the leader of the otolaryngology at the Hospital de Especialidades Eugenio Espejo, has to radiation Médico that in the last 2 years cases of pituitary tumors have increased in the 30%. Video 4.
The gamma knife, also called stereotactic radiosurgery, is a type of radiation treatment used commonly for brain tumors. It may also be used for other abnormal conditions of the head. The gamma knife is a non-invasive surgical procedure that doesn't require incisions, which are cuts through the skin. Instead, a machine precisely focuses and delivers about 200 beams of radiation onto a target area inside the head. The radiation only kills abnormal cells, while sparing the normal tissue around them. The gamma knife treats small brain tumors, blood vessel malformations, and nerve conditions that are hard to reach or too risky to treat in other ways. The gamma knife head frame has 4 pins or screws. After numbing the scalp, the doctor will attach the head frame with the screws. The frame prevents the head movement and helps guide the radiation beams. With the head frame in place, an imaging study, such as an MRI or CT scan, will be done to determine the exact size, shape, and location of the target to treat. The treatment team will use the imaging studies and advanced software to create a treatment plan. Then, the patient will lie down on the gamma knife couch. A radiation helmet will be positioned over the head frame. The helmet contains holes that allow only the programmed radiation from the treatment plan to pass through. With the helmet in place, the couch will slide into the radiation unit. The procedure is silent and painless. It takes a few minutes to an hour or more, depending on the size and shape of the treatment area. The effect.
Conclusion. Because pituitary condition can lead to adenoma state because different pathologies such as autonomic hormonal hypersecretion, which tend toward cause disease, the ideal procedure was the surgical resection, although there is the possibility that the tumor may grow again after surgery, even with cavernous invasion, for which there is irradiation and medical therapy are already exposed. 5 video. Thank you.
This animation illustrates the removal of a large tumor near the pituitary gland using the endoscopic endonasal approach, or EEA. The entire procedure is performed through the nose and sinuses, without incisions to the face or skull. First, the endoscope is inserted through the nose and sinuses to directly reach the tumor, without manipulating the brain or important nerves. The tumor and surrounding area are brightly lit by the endoscope, which has a tiny camera that sends real-time video images to a large screen. Specially designed surgical tools are inserted next to the endoscope to cut through the tumor capsule. In this example, bits of tumor are removed with suction and microscissors until the entire tumor is gone. Throughout the procedure, the surgeons have an excellent view of surrounding tissue. There are important nerves and optics.
Thank you so much.